Time now for Restoring the Soul of Healthcare from the HELPcare Clinic in Austin.
This is the first Thursday of the month, and we get together with our friends from the HELPcare Clinics. We welcome Dr. David Strobel and Lee Aase to the program. Gentlemen, good morning.
Good to hear from you.
Thanks, John. Yeah, good to be with you.
Good to hear from you as always, and a couple of interesting topics to chat about here today.
Yeah, we've got a couple topics that we think will really be appealing to some listeners. The first is our what we're calling the HELPcare Challenge, which is something that is for people who are maybe over 40, maybe over 50. They're not feeling as healthy as they used to. Maybe they gained some weight gradually over the years, and they're just saying, I'm not really happy with my health. So we've got a more intense version of the health coaching that we make part of the membership at HELPcare Clinic. It's called HELPcare Challenge, and it starts with a baseline panel of 8 blood tests that are included in the program that takes sort of their baseline health status along with the body composition report. And then it's a 13-week challenge, and we're calling it Healthy New Year, the Healthy New Year Challenge. A lot of people start their New Year's resolutions and they try to make changes. We're saying get a head start on it and take advantage of this new program. Our plan is, or our promise is, that you will be healthier by the beginning of the new year, or your money back. We've got a money back guarantee because we've seen lots of people within the healthcare clinic practice make some lifestyle changes that have really helped them to turn around their health.
And this really isn't about just weight loss or things like that. It's really about moving the needle of where you feel and operate on a daily basis when it comes to your health.
Yeah, that's absolutely right. I mean, we've talked about the metabolic syndrome multiple times in the past. The metabolic syndrome is 50% of Americans have it, and another 40% have at least one part of it. It's got 5 criteria. You need 3 of them. And obesity, that is too much fat weight, it's not too much total weight, too much fat weight, is just one of those criteria. Mm-hmm. So everybody looks at that one and they look at their scale and that's what they focus on. But all the other parts of the metabolic syndrome improve very quickly when you make the changes. And those you can demonstrate with various different lab tests or other studies. And then if you stick with it, the weight loss comes off, or the weight loss occurs. And so everybody thinks, well, this is just a weight loss thing. It's like, well, no, that just proves that you were successful, because the changes in the lifestyle have already led to the other changes of the metabolic syndrome, and those are measurable too.
Yeah, and without doing all the other things, you may lose a bunch of weight, and we've seen people do that through the years where they do this whatever program they're on, they just purely for weight loss, but they don't make the lifestyle changes, and then they get off the program, that weight comes right back.
Right, and you focus on the wrong thing, and so then you aren't really focusing on the problem. You just keep putting air in the tire rather than patching the hole.
Yeah, the weight loss is just a welcome side effect.
Sure.
I mean, you added the weight over time, and you need to start reversing the underlying causes, and then eventually the weight loss follows, and it's a very welcome side effect.
Absolutely. And so, and I know we'll get this later on, but if anybody's interested in finding out more about this challenge or getting onto the challenge and getting on this journey with you, what do they need to do?
Yeah, well, they can give us a call at 507-279-2345. They can find out more about it on the website at helpcare.health. It's one of the featured posts on the front page of the blog. But we do have just 10 spots available as part of this first challenge. And so we start October 17th with this, and it'll go for Tuesday nights from then through the 9th of January. And then at the end, we'll do the blood tests again, and we'll be able to show people that they've really made a difference.
It'll be interesting to hear the results, too.
Yeah, we're looking forward to being able to share that, and we've seen a lot of this with the individual coaching that we've done, but this is taking it up a level. We've got a registered dietitian who's part of the program now. We're also adding some additional health coaches that will be part of it eventually. And so our goal is that for people who aren't yet members, that this is a way for them to get part of the experience of HELPcare Clinic. The other part is that for our current members, they get a 50% discount because they're already paying for the lab tests and things like that as part of their membership.
And I like that you're quite literally putting the money where your mouth is. You're saying, get on this program, do the work, we'll guide you through it, and we're going to show you results.
Right. Yeah, exactly. Yeah, and we want people to recognize that they have skin in the game. They need to have a commitment to it, but also that we're there with them just as committed, and that if they don't get the results, if they don't feel like they're making progress, if they don't see in their lab results, for instance, that they're getting healthier, money back guaranteed.
Right. And when people say, well, everybody's different, and that's true, but it's also not true because the physiology is pretty much all the same. And so everybody's the same. And that's the reason that we can say, all right, this is a program that works. Does it work in 100% of patients? Well, not quite, but it's a high enough percentage that we can say we're going to help you.
Just real quick, we got 4 minutes to go here, and I know we want to get to the open enrollment period because this is a time of year that I think for a lot of people, very confusing if you're not really into it and you get all your paperwork and you're looking at different programs and things. So it's an important time of year to really pay attention to that, and you have an opportunity, too, for people to take a look at what you've got going on.
Right, so we're calling it our Open Enrollment Open House series. So for the next 5 Thursdays, so starting next week, October 12th, we're going to have an open house from 5 to 8 p.m. right here at HELPcare Clinic where people can come in and, first of all, take a look around, see what this is like, and see what the environment is like. But they can find out more about what how our membership works, and how it connects to the decisions that they're making about open enrollment, like what kind of deductible plan do they want to have. How would HELPcare Clinic membership work with whatever insurance they have? And so this is a chance, people can do that anytime. Like they stop by Monday through Friday, 8 to 5, or Saturdays, 8 to noon, and we'd be glad to talk with them. But some people, it's not going to be as convenient to be able to do that during the workday. And so we're going to be around from 5 to 8 p.m. on these next 5 Thursdays. For people who want to, stop by and have a discussion and really better figure out how this works for them.
Yeah, that's probably the most important thing in this time of year is really get a good open view of all the options and find out what works best for you.
Yeah, because, for instance, if you take a higher deductible with your health insurance plan, with your regular health insurance plan, you're going to save on your monthly premiums. And so that could actually offset a big part of what your membership would be with us. And then meanwhile, you can rely on HELPcare Clinic to provide that 90 to 95% of the care most people need. And then they still have the insurance for the catastrophic issues, and you still want to have that. But the decisions that you make between now and, say, November 15th are the decisions that will affect what your insurance costs are for the coming year. And so those things kind of get locked in for for people in Medicare. It's a little different, but for people with regular insurance, it's usually by November 15th that they need to make that decision.
All right, very good. And would you encourage people to sign up in advance for that, or can they just show up, or how's that going to work?
It's kind of like a real estate open house. You don't have to sign up for that. So just come whenever you can. And actually, we really welcome people to stop by from 5 to 8 on those Thursdays. But if they want to come during the regular workday, if that's convenient for them, we'd love to be able to talk with them as well. We'll have more of a tour opportunity for the people who come during the open houses because we're busy seeing patients other times. But we definitely can have people get a look at the program and also then just answer their questions because it does, in their own situation, they'll need to figure out how this works for them.
Absolutely. We got about 45 seconds. Let's remind people how to get a hold of you and where they can find you on the World Wide Web.
Sure. HELPcare Clinic in Austin is at 308 4th Avenue Northwest, which is a block east of St. Augustine's, a block west of the Hormel Historic Home, so right on 4th Avenue Northwest. They can go to HELPcare.health, which is our website, and they can see the blog posts that we've been talking about and get other information. Or they can give us a call at 507-279-2345, and we'll be glad to answer the questions.
All right. Fantastic information as always, gentlemen. We appreciate it. We'll talk to you next month.
Thanks, John.
Thank you. Bye-bye.